My name is Marvin Mata. I'm a life science major at Montgomery College. This past winter break, I was fortunate to have an opportunity to go on a study abroad program to Ethiopia and study at the University of Gondar. I can truly say that this abroad trip was a life-changing experience for me. It made me realize how lucky and blessed I am. I made friends and developed friendships that will last a lifetime, learned a little Amharic, but most importantly, I learned more about myself and how I could leave a small positive impact in someone else's life. Ethiopia, the land of rich history, amazing culture, and incredible people. But despite of these amazing things, it is prone to many deadly diseases. As many of you may know, HIV/AIDS was a huge epidemic, and in many third world countries it still is. With advanced medicine and science, it has now been something that you can manage and live a regular life with. Based on a single point estimate, there are nearly 1.2 million people living with HIV/AIDS in Ethiopia. But with the responses to the HIV/AIDS epidemic, Ethiopia has managed to maintain and reduce these rates. The primary mode of HIV transmission in Ethiopia is through heterosexual contact. Young women are more prone to the infection than young men are, and urban women are 3 times as lucky to be infected as urban men are. While carrying on many research, I focused on what were the main contributions to HIV/AIDS and how Ethiopia and the University of Gondar were contributing to the efforts of fighting the virus. While doing my research, I found that much of the government spending has been diverted to the spreading of the drugs to combat the disease. Also, Ethiopia has established a huge educational campaign, especially focused on schools and workplaces. It is also advocating in the media and the internet. There are many programs which focus on distributing the antiviral drugs to people who have HIV/AIDS. Ethiopia also has 2,309 health facilities to help provide HIV/AIDS counseling and testing services. Additionally, the University of Gondar Medical School, with the help of the United States, has recently built a new hospital, which will focus on treating and helping HIV/AIDS patients. These are just a few examples on how the country and the university is combating HIV/AIDS. I had a chance to visit 2 hospital facilities, had the great pleasure of meeting with the Dean of the Medical School of Gondar, and met with many physicians. Not only did this trip make me realize that, in fact, I do want to become a doctor, but it allowed me to be able to witness the practice of medicine firsthand in a global setting and broaden my perspective on the medical vocation in general. Overall, the trip was phenomenal and very educational, and this would not have occurred without Professor Greg Malvo and the Scholarship Selection Committee for enabling this special opportunity for me. Thank you.